pregnant and experiencing sciatica pain or sciatic-like symptoms, let's go over a chair flow routine that will help to alleviate some of the issues, pain, and discomfort that you're feeling from this tightness or sciatic nerve pain symptoms. So we're going to start with just a regular chair, and we're going to face the chair and do a supported forward fold. So legs wider than the chair, folding down, and if this is your max, that's fine. If this is as comfortable as it is for you, okay. We're going to also work at kind of shining our tailbone up toward the sky, or taking a really pronounced interior pelvic tilt, so like we're tipping our pelvis forward. And this is going to help stretch the muscles of the glutes that attach to the hamstring and get a little bit more of a stretch through the back of the leg there. Now, if you find that you can take a little more, you can come down onto your forearms, and more still, you can come down onto stacked hands. Wherever you decide to come in this stretch, release your head so your chin is tucked into your chest and you stretch through the back of your neck. Each one of these stretches, I'm going to suggest about a 3 to 5 breath hold. So it's about 30 seconds to 45 seconds, depending on how long your breaths are. And then when you've reached your final breath, little bend in the knees, come back up, and we're going to do some windmills. So left arm comes to the middle of the chair, and we're going to bend the left knee and straighten the right leg as we reach the right arm up and open, looking up toward the sky, if that's accessible. If that does not feel comfortable on your neck, keep your gaze forward or down. And then we're just going to go to the other side. So right knee bends, right hand comes down to the chair, left leg lengthens, and left arm reaches up toward the sky. Now, after you do this initially for a breath or two on each side, you can flow from side to side and allow the hips to gently swing with the opening of your arms. And make sure you breathe. Everybody always wants to know how long they should do a posture for, or a movement. And while I suggest at least a minute, do what feels best for you. Very nice. After that, we're going to bend the knees, hug baby in toward the spine, so like you're giving them a hug in toward your back, and then take your hands up, and up you go. Now we're going to come to seated in the chair for these last couple of stretches. We are going to find a figure 4. So with your figure 4, one leg crosses over the other. If you need to give it a little help, you can wrap a towel or a strap around your ankle and lift it up onto your leg. And so some people might find that this is really tight through the hip muscles, the glutes, and this may be where you are, and other people might find a little more range of motion. Wherever you are, let's take a nice stretch here. If you need a little bit more and you find that that's not quite enough of a stretch for you, I suggest back nice and straight, hinge at the hips, and just gently fold over your legs until you feel that through the other side, but this area right here, maybe up through your lower back, glutes, hips, and breathe. And after you reach that third breath, inhaling through nose and exhaling through mouth, we're going to come up and switch. Other side. Come to the part of the posture, or the expression of the posture, that feels best for you. Now, some people like flexing their foot here. If it's more comfortable to keep foot relaxed instead of finding flexion of the foot that's on top of the leg, that's fine too. 3 to 5 breaths, in through nose, out through mouth, and release. Very nice. Slowly lower that leg down. And now we're going to do an IT band stretch. So for this stretch, we're going to take our hands to the back of the chair and hold on to the chair. Left knee is going to drop in toward the right leg, and then we're going to cross the right leg over the left. So it looks kind of like a fanciful cross legs, if you will. Now, where we're going for in this stretch is this whole kind of IT band area, piriformis, glutes, outer thigh. If you're feeling pressure on the knee, don't put direct pressure on the knee. Try and change your footing so the pressure is on the leg and not on the knee. And then we'll uncross, bring the knees back to center. Other side, right knee drops in, left leg crosses over. So both of our sit bones are on the chair, although we are more onto the left sit bone at this point. So the leg that's on the top, we're a little more weighted into that side of the body. And then we're going to uncross, very nice. Remember, you'll be holding these for a little bit longer, 3 to 5 breaths, which is about a minute or so, depending on how long your breaths are. And then I've got a couple more for you. So you can do some seated cat-cows here. So when we do our seated cat-cows, we're going to let the knees be a little wider than the chair, gaze and collarbones, gaze up to the sky, collarbones spread, and then we're going to round the back, chin to chest, big C-curl in the spine. And you're going to do this a few times as you warm up your spine. And then if you want a little bit more of a stretch, you can lean forward and hold onto the chair and allow this chest to stretch out even more. Make sure you hold on nice and firm and steady to that chair. Very nice. And then we release, come back to neutral spine. Some moms like to take a forward fold here and let head hang. If you're having some lightheadedness or blood pressure issues, this one might not be so comfortable. And if you find that you really enjoy it, you can bring your hands down in between your feet and fold all the way forward. And then slowly walk your hands to your legs, roll up through your spine. The very last movement is a gentle twist. Arms extend overhead, right hand goes down to the left knee, and the left arm comes to the back of the chair, just like that. 3 breaths here, in through nose, out through mouth. And when you finish that 3rd breath, we'll twist back to the front, arms extend, left hand to right knee, right arm behind you, gazing over to your right. 3 breaths in through nose, out through mouth. Slowly twisting back to center. And that was your mini movement session to help with sciatic or sciatic-like nerve discomfort. If you would like more of these types of classes, you can find the link to my online course, Your Empowered Pregnancy and Birth, below. Thank you. My name is Jessica with Mama Shakti Prenatal. Mama Shakti means Mama Power.